a package of evidence-based practices recommended by the Department of Health, PhilHealth, World Health Organization as a standard of care in all births by skilled attendants in all government and private settings. So it includes a series of time-bound, chronologically ordered standard procedures that a baby receives at birth. This includes immediate drying, skin-to-skin contact, delayed cord clumping, and then separation of the baby from the mother. First is the immediate drying. So this is done by using a clean, dry cloth used to dry thoroughly the baby by wiping the face, the eyes, the head, the arms, and legs of the newborn. Next is the skin-to-skin contact. So if a baby is crying and breathing normally, we usually avoid any manipulation, such as routine suctioning, which may cause trauma or introduce infection to the newborn. For the skin-to-skin contact, we place the newborn in a prone position in the mother's abdomen and cover the newborn's back with blanket and head with bonnet and place the identification band. The third is proper cord clumping and cutting. So we usually clump and cut the cord after the cord pulsations have stopped, typically at 1 to 3 minutes. Then we put ties tightly around the cord at 2 cm using cord clamp and 5 cm from the newborn's abdomen and cut it with a sterile instrument. Fourth is the non-separation of the baby from the mother and breastfeeding immunization. So continuous non-separation and early breastfeeding protects the infants from infection. The Upward score is a practical method of systematically assessing the newborn infants immediately after birth. So a low score may be the result of fetal distress, but may also be caused by a number of factors, including prematurity and drugs given to the mother during labor. It is not designed to predict the neurologic outcome. So the Upward score provides an accepted and convenient method for reporting the status of the newborn infant immediately after birth and the response to resuscitation if needed. It comprises of 5 components: the color, the heart rate, reflexes, muscle tone, and the respiration, each of which is given a score of 0, 1, or 2. The score is reported at 1 minute and 5 minutes after birth for all infants and at 5-minute intervals thereafter until 20 minutes for infant with a score less than 7. Another concern in newborn is the maintenance of body heat. So they are at risk of heat loss and hypothermia. So this is due to the large surface area to body mass ratio of the newborn and decreased subcutaneous fat. So the estimated rate of heat loss in newborn is approximately 4 times of an adult. So the heat loss occurs by 4 mechanisms. First is the convection, in which the heat energy is transferred to the color surroundings. And second is by conduction of heat to the colder materials touching the infant. Third is through heat radiation from the infant to the other nearby cooler objects. And fourth is by evaporation from the skin and lungs. So there are different complications of hypothermia. This includes metabolic acidosis, hypoxemia, hypoglycemia, and increase in renal excretion of water and fluids. So to reduce the heat loss, infants are dried and wrapped in blankets, and they are placed with the mother for skin-to-skin contact, and sometimes also placed under radiant warmers. So antiseptic skin and cord care is done by using bactericidal or antimicrobial agents. So this to protect infants from gonococcal ophthalmia neonatorum, we usually give erythromycin or tetracycline. Other measures includes giving of vitamin K at 1 milligram IM and hepatitis B immunization after birth. And after 24 hours, the baby is subjected to newborn screening, and prior to discharge, hearing screening is also done. So that would be all for routine newborn care. Thank you very much.